we are going to move in effective Monday into what I would call a full phase one. Some of the things that we could have done but didn't do initially, we are now adding, and I think that this is appropriate given the progress that Florida's made. I think it's fully consistent with our safe, smart, step-by-step approach. And I know I've had people like the mayor asking me, when can we do more, when can we do more? And I appreciate that input because he's the guy that's on the ground. He knows, he's talking to all these folks, the business owners, the moms, the dads, and it's all very important to hear that. And I think we're hearing that throughout the state. I was yesterday down in South Florida with Mayor of Broward County, Mayor of Dade County, and they have plans to go into the initial phase one. So they're going to be doing that on Monday. They had been counties that we didn't include initially because they had a different scope of the epidemic. But I think you've seen a lot of desire to be able to move forward. I think everyone's committed to being smart and being safe, but I do think people want to move forward. And why would we have moved forward to begin with? Remember, when we went into mitigation as a country, the reason why people said that we needed to do it, because if you let the disease simply spread or spike, you could be in a situation where you overwhelm the hospitals. And the hospitals wouldn't have capacity to treat patients. That would, of course, lead to excess fatalities. So by doing mitigation, you, quote, flatten the curve to make sure that the healthcare system keeps up with this. There were articles written in Florida newspapers in March saying that by April 24th, Florida would have 474,000 Floridians hospitalized because of COVID-19. Now, I don't know what that number means to people that aren't familiar with kind of the system here, but I can tell you we have about 70,000 licensed hospital beds in the entire state. So if they're saying 464,000 hospitalizations, that means you'd have almost 300,000 people with no ability to get care at all. So that was a terrifying prospect. I mean, that was sowing a lot of fear and angst. It wasn't based on any real data or facts, but it was put out there. And so I kept that in mind because I knew, our approach was going to be effective. And on April 24th, we didn't have 464,000 hospitalized. We had 2,000 statewide hospitalized, and most of the hospitals in the state had close to 50% capacity. So the curve was flattened. We never had anyone that was even threatened without having a bed or a ventilator or what they needed. And so because we succeeded there, it doesn't mean the disease is gone, doesn't mean that we're not going to still have to do things to be able to protect the folks that are the most vulnerable. But the American people never signed up for a perpetual shelter in place. And we need to be able to get society functioning again. So that's why we did it. It was based off the data. It was based off the facts. It was based off the trends, the hospitalizations. And that's why we're now able to go to full phase one. One thing I'll say before I go into this, when you're looking at new cases, and we've seen prison, some of this other stuff, it's important to note that. But the most important thing that I'm looking for are how many of those cases are clinically consequential. I mean, if we're testing asymptomatic people in their 20s, these are people that may never even know they had the disease or have it so mild. So if you have 1,000 people who are healthy in their 20s get it, you're going to have less clinical significance of that than if you had 100 people who are 85 and plus in a nursing home. And so part of our strategy going forward is obviously we'd like there to be no cases, but I don't think that this disease is just going to go away. But can we not have as many clinically significant? And certainly we've seen fewer clinically significant cases over the past 3 or 4 weeks, which is a really, really good sign. All right, so full phase one, what does it mean? The long-term care facility is going to be a big part of phase one, even more going forward. We want all staff to be tested, and that's just very important. That's going to be a multi-pronged approach. We do need long-term care facilities who have the ability to self-test to let us know. We can provide the lab capacity. We can provide the supplies. If you have people who are trained to do that, very important because that's a force multiplier for us. And we're also going to continue to expand our great mobile testing teams with the National Guard and the Florida Department of Health. From the beginning, we've said any healthcare workers, you go through these drive-through sites, no problem. We also have serological testing, Jacksonville, Orlando, Palm Beach, and Miami. We're going to be expanding that. That's great for healthcare workers to know, particularly if you work in a nursing home, do you have the antibodies? If you have the antibodies, then that's a huge thing for a nursing home to know about some of its staff members. So we would encourage frequent testing for diagnostic, but also take the antibody test, very, very important. And we are working with the hospitals, just what Ascension is doing by going into these communities and doing testing, particularly at facilities where we may not have any evidence of an outbreak, to make sure there's no asymptomatic spread going on. Very, very important. They've been great here. You have some other places around the state, like the Cleveland Clinic, have done great. And so we just want to encourage hospitals to do that. It's in all of our interest to protect the vulnerable, but also just from a healthcare resource perspective, if you keep it out of the facilities, you're going to devote less resources to patients coming in because there aren't going to be as many as that are infected. And then obviously we were going to work with integrated public health system, local county health departments, very important. Obviously the mayor can work with his here. Carlos Jimenez down in Miami, he's all over this, and it's very, very important. So we want to continue to do that. We're also going to continue to do the elective surgeries. It's important for people's health, and the hospitals have proven they can handle anything that comes with COVID and still do this. All right, restaurants. We had started initially outdoor seating 6 foot apart with 25% indoor capacity. We are now going effective Monday to operating up to 50% capacity, and a lot of that is based off the spacing of the tables, or if you have some type of partition, because I've had some restaurateurs tell me, hey, I got plexiglass, my booths, I can't move them, but I have plexiglass. That's fine, that's effective. All we're trying to do is create a low-risk environment. And I really appreciate a lot of the folks that own restaurants who have been thinking deeply about this throughout this crisis. A lot stayed open to do takeout, but some didn't. And some are more conducive to dine-in. That's just what they have to do. We also, I think, the outdoor seating has been interesting. You've had some cities where they've closed parts of the street so that people can have more room to do outdoors. And that's just based off the science that this thing is not as transmissible outdoors as indoors in an enclosed environment. So I think that that's something that a lot of the people in the restaurant industry were hoping for. I think it can be done safely. A lot of other states already went to that right off the bat. My initial recommendation was to do 50% for my task force. I wanted to ease into it, but I think that they've really thought well about it. So that'll be effective on Monday. And the same with retail. We started off with 25% of indoor capacity, go to 50%. There's very clear guidance from CDC and OSHA, and I know a lot of the retailers have been doing it. And look, we were doing retail in some form or another this whole time. You had Home Depot open, you have Walmart, you have all these places open. So there's not a whole lot of difference to me between going into a Home Depot or going into a Joann Fabric or some of these other places. I mean, you can do it, and particularly for our smaller mom and pop retailers, very, very important for them to be able to have safe options for their customers. Museums and libraries, 50% capacity. That'll be, local governments can obviously make those calls in terms of the museums and libraries that they're operating. Gyms and fitness centers. So effective Monday, gyms can operate. Make sure that you have respect the social distancing capacity. I would say for some of these places like CrossFit that do outdoor training, that's great. The outdoor stuff, again, that's a lower risk environment in an outdoor than if you're inside a stuffy room in a gym doing something where you're going to potentially be exposed to respiratory droplets. So we would tell people, just like how the restaurants are seating, I've seen people out in CrossFit and all these other ones doing things outside, that's fine. If you're inside, make sure you're doing the social distance, and then sanitize machines and surfaces after use. I mean, that should be happening anyways. I mean, if you're sweating on the dip bar, clean the dip bar when you're done doing dips. I mean, come on. But I think it's important, and CDC was really about close the gyms. And I was like, okay, look, I tried to work constructively, but you think about it, this is a respiratory virus that tends to attack people who have some health problems or who aren't as in good physical condition. So don't we want people to be getting exercise? Don't we want people to stay in shape? It's going to actually make them more resistant to severe consequences. So I think this is good. I think it's important, and that'll start on Monday as well. Professional sports venues, I've been vocal the last couple days. Any Florida team, basketball, hockey, baseball, you obviously could train all you want. Basketball, I know the NBA, some of these places are thinking about getting back in. Go ahead and train, no problem. And then once the season starts, you're going to be able to use our venues, use the venues. We want you playing. I've also said to other teams and other leagues is if you have states that simply are not going to budge and allow even competition with no fans, ESPN in the morning now, you watch, they have Korean baseball on. There's nobody in the stands. So how is that? That's not going to bother anybody. So I think it's important that we get sports back up and running. The mayor and I worked on bringing UFC to Jacksonville. And what was happening was UFC was running into problems in California, some of these other places. They wouldn't let them do it. And I'm thinking to myself, okay, they want to fight in an empty arena. They test the people before they go. That is as low risk as you get. And so I said, if you do, I'm 100%. We reach out to UFC. We said, guys, come. And I think it's been very successful. And then now what happens is UFC knows they have a welcome environment here in the state of Florida, just like WWE knows. And we had to cancel WrestleMania in April. That's hundreds of millions of dollars of economic impact. We've allowed them to keep using their training center and film. They know Florida is a good place to be. We're going to get a WrestleMania back here, as soon as we can and get that economic impact. But any of these teams in other states where they're just not going to let them play, we have additional facilities here. I've already spoken to some of the universities, and I think it would be fine if people want to use facilities here. We welcome it. We think it's very important to do and to get back going. And I know some of the leagues are working on when they come back. Baseball maybe July. I know the NBA. Some of the players are talking about we got to get back on it. So we'll see what happens. But we've I think done a good job of welcoming this stuff done. UFC, there's a charity golf match at Seminole Golf Club down in Juno Beach on Sunday. It's going to be on NBC. You got Dustin Johnson, Ricky Fowler, Rory, some of these great players at probably the best, most iconic course in Florida. And then the following Sunday, you got Phil Mickelson, Tiger Woods with Tom Brady and Peyton Manning. And they're going to do that in Florida too. And both of those events are going to raise millions and millions of dollars for charity. So we're happy that those are being hosted in the state of Florida. Amusement parks. Parks can submit reopening plans to the state. They should identify the date certain that they believe that they could resume safe operations. They have to provide how they're going to do it, how they're going to accommodate the guests, how they're going to protect the staff, and then they need to have an endorsement from the relevant official in their locality, Orange County mayor, wherever you're talking about.